So in this lecture we will see the abnormality of pituitary gland due to the abnormal secretion of growth hormone. So why the pituitary gland? There may be abnormal secretion of growth hormone in the form of excess release of secretion of growth hormone that causes hypersecretion, or in the form of reduced release of secretion of growth hormone or called as hyposecretion of growth hormone. So because of hypersecretion of growth hormone or excess secretion of growth hormone, there may be three kinds of clinical abnormality occurs in the individuals on the basis of age group in which excess secretion of growth hormone happens. So if there is excess secretion of growth hormone occur before the puberty or before the epiphyseal closure of long bone in individual, then it will develop gigantism. So in gigantism, as I said, the excess secretion of growth hormone occur before the epiphyseal closure of long bone. So there is excess growth of long bone of the individual. So individual attain huge height and it appear as a giant. Now come to the acromegaly. In this condition, there is excess secretion of growth hormone after puberty or after fusion of epiphyseal cartilage with the long bone. So in this condition, there is no increase in height of individual. So individual attains the normal height, but there is growth of cartilage in the area where the cartilage is still persist, like that in membranous bone or acral part of body like ears, hands, feet and fingers. So individual attains the body build as stout or stocky. So there is enlargement of membranous bone of the face. So it appears as acromegalic face. So bone grow here only in thickness, not in the length. So this type of abnormality is called as acromegalic abnormality because of excess secretion of growth hormone. Now the third condition in which growth hormone excess secretion continue from adolescent to adult life means excess secretion of growth hormone continue before the epiphyseal fusion to the after epiphyseal fusion in adult life. So this kind of individuals develop mixed feature of gigantism and acromegaly, and these features are called as acromegalic gigantic features. Now come to the hyposecretion of growth hormone. Again, according to the age group, if this hyposecretion occur in the growing children or in childhood, then it creates dwarfism. We will discuss in detail in the subsequent slides. And if hyposecretion occurs in adult age group, then it causes only mild anemia and can be treated with hematinic supplements and causes loss of mass of muscles and can create hypoglycemia. So this was an overview that appears due to the hypersecretion or hyposecretion of growth hormone. So in a summary, if there is hypersecretion of growth hormone before the puberty, it develops gigantism. And if hypersecretion of growth hormone occur after the puberty, it develops acromegaly. The main difference in gigantism and acromegaly is the individual attains huge height and looks like a giant in gigantism as the name says, but in acromegaly there is normal height of the individuals and there is enlargement of acral body part like fingers or hands and feet, and that's why it is called as acromegalic condition. And if hypersecretion occurs in both age group from adolescent to adult life, so it develops acromegalic gigantic features. And in hyposecretion, In childhood, it develops dwarfism, and in adulthood, it develops mild anemia, loss of muscle mass, and hypoglycemia. So let's see one by one in the subsequent slides. So first we will take the hypersecretion conditions. Like first we will take the gigantism. So gigantism is a clinical condition in which excess secretion of growth hormone occur before the epiphyseal closure of long bone. So there is excess growth of body. So subject looks like a giant with height of approximately 7 to 8 feet in average. So causes of gigantism is mainly the tumor of acidophilic cell in anterior pituitary gland. So come to the sign and symptoms of gigantism. Sign and symptoms of gigantism occur because of excess secretion of growth hormone and because of feature due to the tumor mass nearby pituitary gland or in pituitary gland. So clinical signs and symptoms that occur due to the excess secretion of growth hormone are abnormal height, approximately 7 to 8 feet. So see here in this picture, there is an abnormal height of approximately 7 to 8 feet. And see here also, there is an abnormal height of approximately 7 to 8 feet. And this is the normal person. So these are the twins. And in this, there is excess secretion of growth hormone that develops height approximately of 7 to 8 feet. The second feature, due to the excess secretion of growth hormone, there is large hands and feet because of enlargement of membranous bone. So there is large hands and feet also. So there is large feet and hands. So because of these large feet and hands, so it again looks like a giant. And there is coarse facial feature, means facial features are very coarse looking, like increased thickness of skin and widening of nose and lips, ear, etc. In males, due to the excess growth hormone secretion, it develops bilateral gynecomastia because growth hormone can create signs and symptoms like that of prolactin release. And in male, it causes loss of libido and impotency because of features similar to the prolactinemia. And due to the excess secretion of growth hormone biochemically, it causes hyperglycemia and excess insulin secretion. In gigantism, feature due to the tumor mass can develop signs and symptoms of headache because of increased intracranial tension. It can develop visual field defect because of compression of optic chiasma or optic nerve. And it causes cranial nerve palsy because of compression or irritation to the nearby nerve of pituitary gland. And it causes enlargement of pituitary fossa and destruction of clinoid process that can appear in radiographic images. And finally, or ultimately, it will end up into the pan-hypopituitarism because of compression of tumor mass to the whole pituitary gland. So these are a clinical sign and symptoms that develop because of excess growth hormone secretion in gigantism and due to the features of tumor mass in gigantism. Now come to the second abnormality of hypersecretion of growth hormone that occur in adult age group. So that is called as acromegaly. So acromegaly is a clinical entity in which excess secretion of growth hormone occur after epiphyseal closure to the long bone. So there is enlargement and thickening and broadening of bone in those areas where cartilage still persists, like in membranous bone and acral body part like hands, feet, etc. So causes of acromegaly is again tumor of acidophilic cells that causes hypersecretion of growth hormone after fusion of epiphysis with the shaft of bone. So here the signs and symptoms are again because of excess growth hormone secretion and features due to the tumor mass. So features due to the excess growth hormone secretions are like facial features. So particular facial features that develop in acromegalic condition are called as acromegalic facies or gorilla facies. We will see in next picture. The second features like bulldog scalp. The acral enlargement, acral means peripheral body part enlargement like hands and feet. The enlargement of all viscera like heart, liver, kidney, spleen. The development of diabetes mellitus and bitemporal hemianopia because of compression of optic gland. And features due to the tumor mass are again the same features like in gigantism because of tumor mass, like headache because of increase intracranial pressure, increase visual field defect because of compression on optic chiasma. There is cranial nerve palsy because compression on nearby cranial nerves. There is enlargement of pituitary fossa and destruction of glenoid process that can appear in the radiographic image of skull. And finally, it will end up into the pain hypopituitary in adult life. So see here in this picture, this type of face are called as acromegalic face. So from head to toe, there is bulldog scalp and thickened prominent forehead, it is called bulldog scalp, prominent eyebrows, there is broad and thickened nose, enlarged lip, enlarged tongue causes macroglossia. There is enlargement of lower jawbone or mandible that create prognathism. And there is abnormality in acral body part like hands, fingers and feet. So there is increased thickness and enlargement of hands. So hands are looks like a spud like hands are there. So increase head pad and large feet of the body and frequent change in shoe size of that individual. Here height is normal, but the individual looks like stout and stocky. Individual may develop kyphosis because of improper vertebral growth, and there is excessive enlargement of internal organs. So there may be cardiomegaly, hepatomegaly, renomegaly, splenomegaly, enlarged colon. So this type of pictures come in the individual of acromegaly. In acromegalic individuals, there is increased sympathetic activity that causes increased sweating and hypertension. So there is increased sweating pictures here. There is poor gonadal functions due to the hyperprolactinemia or due to the lactogenic effect of growth hormone. In biochemical features in acromegalic individuals, there is poor glucose tolerance and even occurrence of diabetes in 15% of the cases. There may be development of hypertriglyceridemia and reduced hepatic and lipoprotein lipase activities. There is hypercalcemia and hyperphosphatemia due to their increased intestinal absorption of calcium and phosphate. So these were the clinical features due to the excess secretion of growth hormone in adult life, so it develops acromegaly. And we had also discussed about the acromegalic gigantism because of excess secretion of growth hormone from adolescence to the adult life. So there are both kind of clinical features of gigantism and acromegaly. So confusion in the clinical features of gigantism and acromegaly occurs here. So only difference is the gigantism individuals are of giant in their body build, but in acromegalic individuals These are uh, normal in body build or normal in height, but they are stocky and stout in pictures. Now come to the investigational part of the acromegaly and gigantism. So to detect the physiological abnormality of functional abnormality of acromegaly and gigantism, we have to go through the following tests. We have to see the basal plasma level of growth hormone. So we found it high in concentration. We will see the plasma prolactin level. Again, in 30% of the cases, plasma prolactin level is high. We have to see the glucose tolerance test. For this test, we give 75 gram of glucose orally to the individuals, and we have to take each and every 2 hours the sample of blood to detect glucose and growth hormone level. In normal condition, after giving the glucose 75 gram, it causes hyperglycemia and causes release of growth hormone and causes suppression of growth hormone because of hyperglycemia. But in condition of acromegaly or gigantism, there is no suppression of growth hormone secretion due to the hyperglycemia. Even there is a paradoxical rise in growth hormone secretion to balance the hyperglycemia. So that is a glucose tolerance test to detect the acromegaly and gigantism condition that causes hyper secretion of growth hormone. In radiography, we will see the enlargement of pituitary fossa or destruction of glenoid process. In visual field abnormality, we can detect the normal or bitemporal hemianopia due to the compression of optic chiasma. And in CT scan, we can see the small or large hypodense microadenoma and pituitary gland. So these are the investigations we have to go through to detect the acromegaly or gigantism. The treatment part of acromegaly or gigantism are: we can treat the patient surgically by removing the pituitary tumor without causing damage to the remaining part of pituitary gland. If patient still have acromegalic features, then the second line of treatment is radiotherapy to stop the tumor growth. And we can give the medical treatment also, or medical therapy, in which we have to control the level of growth hormone and insulin-like growth factor 1 concentration in blood. So we have to control the growth hormone level less than 1.5 microgram per liter. So for that, we have to give octreotide, that is the somatostatin analog, and control the IGF-1. We can give the bromocriptine, that can suppresses the growth hormone in acromegalic individuals, but this bromocriptine can induce the growth hormone secretion in normal individuals. So in acromegalic condition, it can suppresses the growth hormone. We can give the dopamine agonist if there is prolactin excess with the growth hormone excess. So this dopamine agonist can suppresses the prolactin excess. And if this bromocriptine and octreotide failed to control the growth hormone or IGF-1 level, we can treat with the pegbisomant, that is the growth hormone receptor antagonist. So these are the treatment part of acromegaly or gigantism or excess secretion of growth hormone. So medical treatment and surgical treatment. Now come to the hyposecretion of growth hormone, that is another kind of abnormality due to the abnormal secretion of growth hormone. So hyposecretion of growth hormone in childhood or growing children, as we had discussed earlier, it causes the pituitary dwarfism. So causes of pituitary dwarfism: there may be panhypopituitarism, there may be genetic deficiency of growth hormone secretion, there may be deficiency of growth hormone releasing hormone, or deficiency of pituitary hormone secretion due to the degeneration of acidophilic cells. or deficiency of pituitary hormone secretion due to the tumor of chromophobe cells. So these are the causes that causes hyposecretion of pituitary hormone or causes the dwarfism in growing children. So what are the characteristics of dwarfism in that children's? So there is proportionately retarded growth. So each and every body part reduced in the growth proportionately. So there is proportionately short body part of that child. So child attain shortness of stature, and but child has normal mental activity, while in dwarf of hypothyroidism there is reduction in mental activity, but pituitary dwarf has normal mental activity. That is important feature of pituitary dwarf. Pituitary dwarf has plumpiness or fattiness in their body build, and these dwarf has immature face, means the dwarf of 20 year has the body structure like that of a normal child of 7 to 10 year of age. So the pituitary dwarf has immature face. They had delicate extremities, and pituitary dwarf has no sexual maturity. So most of the cases of pituitary dwarf, approximately 2/3 cases of pituitary dwarf has no sexual maturity. That means they never attains the sexual performance. But in 1/3 of the cases, there only gonadotropic releasing hormone deficiency is there, so they can attain the sexual maturity but unable to perform the sex. So these are the clinical picture of pituitary dwarfism. Now come to the investigational part of the pituitary dwarfism. So for the functional analysis of hypopituitarism, we have to see the plasma growth hormone level. We take the sample to check the growth hormone level in the night or just after the exercise, because in the day the physiological level of growth hormone is not detectable. So we have to take the sample in the night or after the exercise. So if we see the blood plasma level for the growth hormone, so we found it is low, and we can to detect the hypopituitarism or hyposecretion of growth hormone, there is a gold standard test that is called a stimulation test. For that we have to give 0.15 unit per kg of soluble insulin by IV route, and we have to take the sample at 0, 30, 60, 90 and 120 minutes after giving this IV soluble insulin, and we have to detect the blood glucose level, the growth hormone level. So in normal individuals, after giving the insulin, it creates hypoglycemia and it causes excess secretion of growth hormone, and growth hormone level raises more than 20 nanogram per ml. But in hypopituitarism condition, even after giving this insulin, even after creating the hypoglycemia, there is less than 7 nanogram per ml of growth hormone level. So by this we can check the hypopituitary or hyposecretion of growth hormone. This test is called as stimulation test and called as gold standard test to detect the hyposecretion of growth hormone. Now come to the treatment part of hyposecretion of growth hormone or pituitary dwarf. So to treat the pituitary dwarf, we have to give the growth hormone replacement therapy. So here we are finished with the clinical abnormality related to hypersecretion or hyposecretion of growth hormone. So hypersecretion of growth hormone can land up into the gigantism and acromegaly or acromegalic gigantism. The differentiating features we had discussed very well. The gigantism develops gigant-like feature, while acromegaly has the normal height but stout and stocky body build, and acromegalic gigantism had both kind of features. In dwarfism, there is retarded growth in the individuals, and we had also discussed about the investigations of hypersecretions and investigations of hyposecretion of growth hormone. So gold standard test for the hypersecretion of growth hormone or the suppression test, in which we give the oral glucose of 75 gram and we take the sample. And like that of hyposecretion, there is gold standard test is the stimulation test. So we give the insulin and create the hypoglycemia in individuals and see the growth hormone. In the treatment, the hypersecretion can give somatostatin analogs like octreotide, and we can give the bromocriptine. Like that of in hyposecretion, we can give the growth hormone replacement therapy.